In May 2025, the news that famous actor Cao Ying suffered from stomach cancer swept the hot searches of major platforms. The famous supporting actor Liao Qizi also died of it, unfortunately passed away in 2021 from diagnosis to death, only 4 months apart. According to the data released by the National Cancer Center, the incidence and mortality of gastric cancer are the highest in the world. And the main culprit behind this is lurking in the bodies of 700 million people. It is Helicobacter pylori, a class 1 carcinogen designated by the stomach as the only bacteria that can survive in the stomach's acidic environment. After infection, it can cause bad breath, nausea, and upper abdominal discomfort, gastritis, gastric ulcers. About 2% of infected people will develop cancer. Don't underestimate this 2%, because the number of people infected with H. pylori has nearly reached half of the global population. We can't help but ask, why is the infection rate of Helicobacter pylori so high? Why do some people have symptoms, while others have no symptoms? Under what circumstances do we need to eradicate? Will it recur after eradication? In this episode, let's learn about the pathogenic mechanism of Helicobacter pylori, screening methods, and countermeasures. I hope it can be helpful to everyone. For a long time, the medical community generally believed that the stomach was sterile. Stomach acid, as a strong acid, can make the stomach's pH value below 2. Such an acidic environment can easily corrode bones, teeth, and even metal. It is called a mobile incinerator. Such strong corrosiveness, how could bacteria survive in such an acidic environment? The authoritative Schwartz even asserted that stomach acid is the only cause of ulcers. Under this conclusion, even if there are bacteria, have appeared more than once under the microscope of scientists, but everyone turned a blind eye. Authority leads the progress of the times, but sometimes blind faith in authority can also become the shackles of the times. Barry Marshall, a disobedient gastroenterologist, to prove the existence of this bacteria, he took the bacterial solution, cultured bacterial solution, and drank it all. After 10 days of vomiting, bad breath, and upper abdominal discomfort, Marshall found during a gastroscopy that his gastric mucosa was indeed covered with these curved bacteria. So it often lives in the pyloric part of the stomach. It was named Helicobacter pylori. In 2005, Marshall was awarded the Nobel Prize and proved its association with gastritis, gastric ulcers, and gastric cancer. He was awarded the Nobel Prize in physiology or medicine, and his bold move of experimenting with bacteria also won him the reputation of an academic lunatic. In later studies, people gradually understood that the reason why Helicobacter pylori can survive in weak acid is because it can secrete urease that can convert urea into ammonia. Those who have taken high school chemistry compulsory 2 should know that ammonia is an alkaline substance which can resist stomach acid. It forms a protective layer on the outside of H. pylori, thus avoiding being corroded by gastric acid. It's really amazing. So the question is, this thing, how does it quietly infiltrate into the bodies of nearly half of the world's people? I believe many of you in your childhood have been fed by their parents. Here, feeding means not just ordinary feeding, and they're worried that you couldn't chew or swallow it. So they chew it with their own mouth, and then spit it out for you to eat. This kind of love passed down by word of mouth is one of the main ways of H. pylori transmission. Oral to oral transmission, children's immunity, and gastrointestinal function are not fully developed, are already susceptible to Helicobacter pylori. At this time, adults infected with Helicobacter pylori chewed by children, kissing the child mouth to mouth, or children sharing tableware will increase the risk of infection. Most of the infections with Helicobacter pylori occurs in children and adolescents. Another common route of transmission is fecal-oral transmission. In other words, eating shit. This seems incredible. It's actually not uncommon. Some infected people don't wash their hands after defecation. If they accidentally get it on their hands when wiping, and then use their hands to share the dishes and food, it can be spread. In some areas with poor hygiene conditions, people are used to eating, drinking, and defecating in the same river. The key is that there are red, yellow, and green clothing and hygienic raw water. The probability of infection will naturally increase. In general, the transmission of Helicobacter is closely related to lifestyle and hygiene. The infection rate in Africa is the highest, can exceed 70%. Developed countries in Europe and America, due to the separate meal system and better public health, the infection rate is generally low, which is below 30%. So the question is, if infected with H. pylori, should we eradicate it? To answer this question, we need to first understand Helicobacter pylori, how it behaves in our body. Our stomach can tolerate the highly corrosive gastric acid. It's because the surface of the stomach wall has a layer. Gastric mucosa cells can secrete a lot of mucus, forming a thick mucus layer. This mucus barrier containing bicarbonate is the key to protecting the stomach wall from acid erosion. And Helicobacter pylori, with its tail behind, flagella, that move like propellers, can penetrate this thick mucus. After reaching the gastric mucosa, the bacteria will use surface adhesion factors to firmly adhere to the epithelial cells of the mucosa. Then comes the real killer. The first move is to blow bubbles. It can secrete a toxin called VEC, inducing host cells to vacuolate. What is vacuolation? You can think of it as is to blow up a bubble inside the cell. Blowing bubbles will continuously squeeze the living space of organelles and destroy the structure and function of the cell, eventually leading to cell degeneration and death. And the second killing move of Helicobacter pylori is to use a knife to kill. It can inject a protein toxin called CGA, protein. This toxin can induce epithelial cells to produce inflammatory mediators, thereby promoting inflammatory responses. You know, our immune system is good everywhere. The only drawback is that it kills indiscriminately. And kills indiscriminately. Can you stand it? The gastric mucosa can't stand it either, thus exacerbating the damage. Over time, leading to gastritis and gastric ulcers, and severe cases can lead to stomach bleeding and perforation. Meanwhile, CGA is also an important factor in inducing gastric cancer. The inflammation it causes can continuously damage gastric mucosa tissue cells. Abnormal intracellular signal transduction and bad living habits continue to stimulate the gastric mucosa and accidentally activates related signal pathways, leading to abnormal cell proliferation. Over time, ordinary gastritis may gradually evolve into deadly gastric cancer. The good news is that not all Helicobacter pylori can secrete CGA and VCA toxins. The strains that express these two toxins are type 1, which are highly toxic and harmful. It is closely related to the occurrence of gastritis, ulcers. Those that do not express these two toxins are called type 2. It is less toxic and less pathogenic. The bad news is that adults, whether infected with type 1 or type 2, it is recommended to eradicate because as long as the Helicobacter pylori exists, whether it is type 1 or type 2, it will cause damage to our gastric mucosa. It's just a matter of severity. Chinese Residence Household Prevention, Control, and Management of Helicobacter pylori pointed out that for all adults infected with Helicobacter pylori, eradication of Helicobacter pylori should be considered. For the elderly and children, a cautious assessment is needed. Children have their own specialties in growth and development, and the indications and antibiotic doses need to be strictly evaluated. The elderly have various underlying diseases, and the drug interactions and final benefits need to be considered. Individualized evaluation and treatment are needed. Benefits and risks cannot be generalized. For adults, whether they have symptoms or not, eradicate Helicobacter pylori is the most effective way to prevent gastric cancer. The earlier the eradication, the higher the benefit. The current mainstream treatment options is quadruple therapy and high-dose dual therapy. The quadruple therapy means to antibiotics plus a proton pump inhibitor and proton pump inhibitors. Proton pump inhibitors, MB agents, it usually takes 14 days, with a cure rate of over 80%. High-dose dual therapy means high dose. Only 2 drugs are used for eradication, usually antibiotics, amoxicillin, and a proton pump inhibitor. The reason for using proton pump inhibitors is amoxicillin is a bactericidal drug in the reproductive phase and is easily destroyed in an acidic environment. Proton pump inhibitors can effectively inhibit gastric acid and increase the pH value in the stomach, making Helicobacter pylori inactive growth period. Allow amoxicillin to fully kill bacteria. Both therapies are equally effective, are both recommended in the Chinese guidelines. Recommended specific regimens. Just follow the doctor's advice according to your condition. But here is the but. Don't stop taking the medicine without special circumstances. You must strictly follow the dose and time for continuous medication. Otherwise, stopping and starting will give bacteria a drug resistance exercise. The stronger the resistance, the harder it is to eradicate. We know that many people with H. pylori infection are afraid because they are worried about recurrence after eradication. In fact, after successful eradication, the annual recurrence rate is very low, less than 2%. Some patients who say they relapse actually took the medicine intermittently, resulting in the bacteria not being eradicated successfully. Of course, dietary hygiene and sharing meals are also closely related to the recurrence rate. Some students may have heard that H. pylori can reduce the risk of asthma, eczema, and other diseases. Such cases do exist, but the sample size is very small, and the evidence is not sufficient. Currently, adult H. pylori infections with H. pylori infection Helicobacter pylori is not a probiotic. It is a common consensus in the industry. So how can we tell whether we are infected with Helicobacter pylori? The internationally recognized gold standard is the breath test. Many students may have already done it. During the test, you need to take labeled urea, labeled with carbon, 13 or 14. After a short rest, blow into a special breath bag, and the test is completed. Its principle is also very simple. If there is Helicobacter pylori in our stomach, its urine can decompose urea and produce carbon dioxide. By detecting the carbon-13 or carbon concentration of carbon-13 or carbon-14, we can judge whether there is Helicobacter pylori. It should be noted that carbon-13 can be used for all people's testing, while carbon-14 has a small amount of radioactivity. It is only recommended for adults who are not pregnant. The accuracy of both is over 97%. If you have a family member infected with H. pylori, or a family history of gastric cancer, or have symptoms of indigestion, including bloating, acid reflux, bad breath, and stomach pain, you can go to the hospital to see if there is a Helicobacter pylori infection. Finally, there are 2 points to remind you. First, although the probability of adult infection is much lower than that of children, there is still a possibility of infection. So even if the eradication is successful, we still need to try to adhere to the system of separate meals. Wash hands more before and after defecation, and mouthwash cups. Second, if you or your parents meet the following conditions, it is highly recommended to do a gastroscopy screening. Although it may be a little uncomfortable, but it is one of the few with no side effects, and can detect cancer as early as possible. The earlier the problem is detected, the higher the possibility of curing gastric cancer. Eradicate Helicobacter pylori in high-risk groups and popularize gastroscopy screening. Change the group meal to individual meal. At first glance, it seems that none of them is easy to achieve. However, have we not experienced many difficult things? It may be difficult for us to change the environment at once, but we are also constantly changing the environment. Maybe our descendants can live in an era where stomach cancer is a rare disease. Okay, that's all for this episode. If you think it's a little interesting or it's helpful to you, you can follow us